For the areas of interest for Paula, I chose mobility, eating and feeding, and grooming, dressing, and toileting. For mobility, I would suggest a powered wheelchair that is easily portable for the adapted device, and this is because due to her paralysis, she can't walk, and so she will need a wheelchair, and she also doesn't have great control of her hands, so that would prohibit her from using a manual wheelchair. So a power wheelchair, she can still work with what little function she has left in her hands, and it also needs to be easily portable because she still likes to travel and be out with friends and family and likes to go, and we want her to continue to do that. And this will make it easier on her and her friends and family to get her to where she needs to go. And it will allow her to be as independent as she can and still enjoy the things she does. Goals. The first goal is to maintain an upright, correct posture in her wheelchair for 15 minutes at least, with minimum assistance, if none at all, preferably. And objectively, we will get to this by doing modified sit-ups for core strengthening. And then we will also do sitting in her chair with correct posture with as much assistance as needed, like medial assistance, for 20 minutes or more for endurance purposes. And then we'll also do modified push-ups for upper arm strengthening. This is just in the event that she starts to tip over, and this way she can catch herself, or she can use this to kind of balance herself out if she starts to get a little tippy. And then the second goal will be to navigate her wheelchair through an obstacle course consisting of 15 cones without knocking any over. Objectively, we will accomplish this by doing tasks that involve moving an object from one position to another to work on proprioception. We'll also do hand stretching for hand dexterity and strengthening, and we will also do modified wrist curls for forearm strengthening to allow her to maintain that position and to successfully maneuver the chair. In the areas of eating and feeding, I suggested a utensil holder. This is a device that is a strap that would wrap around her dominant hand, and it has a device inside that a utensil slides in, like a fork or a spoon, and this would allow Paula to eat by herself or more independently, and it would allow her to do it without having to grip the device. So she would still, since she has movement over shoulder and elbow, she could still do this motion without having to do this and risk dropping it or spilling it. And along with that device, I made the first goal, which was to have Paula feed herself using that device and missing her mouth by no more than 0.5, like half of an inch, and with less than 2 spills. We will achieve this by doing supine lateral raises on her back and raising it up into the front, and this will work her upper arm strength so that she can do this with her muscles being adequate to do that. And then we will also do squeezing a tennis ball for hand control and a little hand strength so that she can maintain her hand in that position. And then touching the nose from an extended arm position like this for proprioception to help with accuracy going towards the mouth. The second goal would be for Paula to successfully transfer from her wheelchair into a kitchen chair, whether it be a straight back chair, a bench, or a chair that has arms on it, whichever would be best for her. Initially, it'd probably be a chair with arms just due to the torso paralysis, so it would help kind of hold her up. And we would do this with minimal assistance. Objectively, we would achieve this by doing modified side bends for core strengthening, maintaining an erect, proper posture for endurance, and then modified seated upright lateral raises, and then that would work her upper arms yet again for when using her arms to pull into the proper transfer position. And then for dressing, grooming, and toileting. I would suggest a bath lift, and this is it will be an aid for her caregiver as well as Paula. It will make it easier on them getting into and out of the bathtub, and it also will help eliminate the fear of Paula being dropped, which is a big safety risk, and it will also help prevent back injuries or pain for the caregiver that's lifting Paula up. And it also has a remote so that she can lower herself into and out of the bathtub more easily, so she'll really just need help transferring into and out of the bathtub, or the lift itself. And then I would also recommend a button and zipper pull, which is very similar to the utensil device I already described for eating and feeding, but instead of a spot for a spoon or a fork, it has a loop that you can put a button through, and it has a hook on the other end for a zipper, so you can just pull or push through the hole. And then, so the first goal for that area was for Paula to successfully use her bath lift 10 nights in a row. And then this is with her doing it by herself or as much as possible, especially the lowering and rising up out of it with the remote. And we would achieve this by doing chair yoga for core strengthening and upper or modified rowing for upper arm strengthening, so she can transfer in and out easier in the core so that she can sit upright and maintain a little more stability. And then lastly is pinching exercises for finger dexterity so she can more easily use that remote properly. And then the second goal for this area is putting on and buttoning a blouse using the zipper and button pull with a success rate of 85%. So she would need to successfully button 85% of the buttons in the proper hole. And we will achieve this by stretching her upper arms for flexibility so that she can move her arms to get in the shirt and pull it on across. And we will also do walking the ball up the wall for 6 inches for finger dexterity and strength. And lastly, we would do bilateral coordination activities to work on coordination of buttoning and crossing the axis or the midline to get the shirt across. And on the same train, I did my task analysis on this goal, and it is putting on a shirt with buttons using the buttoner zipper pull. So the first step would be to retrieve a shirt from the closet. Second step, remove the shirt from the hanger, and the shirt would already have all the buttons undone just to make it easier for Paula because of the hand paralysis. And then third step would be to return the hanger to the closet. Can't leave a messy room. Fourth step is to lift the shirt up using your right hand across your body. So it'd be like up here. And then slide. Okay, and it has the tag in the back, but on the inside, and the buttons on the front facing out. And then with your left arm partially bent, you're going to start to slide your right arm or your left arm into the left armhole. And then for step number 5, you would extend your left arm and pull the shirt with your right arm to get it in the proper position. And for step number 6, you repeat steps 4 and 5 for the right arm. So you'd be sliding the right arm into the right armhole and pull with your left arm. And then step 7, you retrieve the buttoner zipper pull from its location, whether it be on the dresser or in the closet. And then number 8, you put the buttoner zipper pull on your dominant hand. So in my case, it would be the right hand. And then you put, as I previously described, it has a metal loop that you slide the button in. You put the metal button holder around the button, the bottom button. We'll start there so that it's more easy to work our way up. And then for step 10, you slide the button and the button holder into the button hole on the bottom. And then 11, you remove the button holder from the hole, but leave the button in the hole and make sure it's secure. Then 12 is you repeat steps 9, 10, and 11 for the rest of the buttons, working your way up towards the top button. And then step 13 is you remove the buttoner zipper pull from your hand. And then 14 is you return the buttoner zipper pull to its original location, wherever it was. And then this will be taught by total chaining with verbal cues as needed. And with this, all of these plans, we're hoping to help Miss Paula in any way that we possibly can, and to make her time at Cookeville High School a great one.